everybody. My name is Dr. Nicole Salvatore. I am the clinical director of Telemedica and the owner of Valor Telehealth. I'm here with some pretty exciting news. We will be starting with sometime this year, probably within the next couple months, a recurring therapy program. What that means is that right now, Valor Telehealth sees veterans for evaluations. So these are independent evaluations for disability claims for mental health. We have several psychologists that we work with right now that help our veterans get service connected. However, we have noticed that even with a service connection, veterans are still struggling with their mental health. The service connection is, of course, helpful, but at the same time, we as an agency want to make sure that we're addressing the mental health needs of the veterans. So within the next few months, what we will be doing is hiring several therapists who will be well trained in multiple types of therapy that are all something called evidence-based. And an evidence-based therapy is something that people have tried in and studied for years and years and years to make sure that it can help reduce the symptoms of a mental health disorder and also help improve your functioning. So this is going to be a positive thing for any veterans who might be interested in getting therapy services. Of course, our goal, if we do an evaluation, is to make a non-biased opinion of whether or not mental health disorders are there and if they did occur in the military. But this is a natural step for Valor Telehealth to be able to offer continuing services beyond just evaluations. We are partnered with Telemedica. They are a company that assists us with administrative work. And so what that means is that if you're interested in the therapeutic services program, you would be using Telemedica for your scheduling, paying, any money for your appointments, any kind of IT issues, because we are a telehealth company, and those obviously come up. And Telemedica also will offer customer support. So as this moves forward, what we're looking to do is find veterans who are seeking mental health therapy. We also are designing our therapy program to be very intentionally based off of what the VA wants and needs in terms of notes and documentation. So the VA has a rule right now that psychologists that have only seen you for evaluation, so that's that one time that you meet with a psychologist for an independent medical opinion, they can't write you a nexus letter because they don't know you very well. After therapeutic services opens, if you are able to see a therapist for a certain amount of time, then the therapist will be able to write you a nexus letter. So that opens up having nexus letters from a mental health professional. All of our notes, by the way, will be completely transparent. What I mean by that is when you do see a therapist, in order to document that you were seen, therapists keep a track of notes. So they write down what happened in the session, goals you worked on, and your progress. These notes will be written in conjunction with you, which is different than a lot of mental health therapists currently. So everything in your note, you will know what is written, and you will have access to that note whenever you want. In addition, the note will mirror, so it will look a lot like what the VA already is used to seeing. What makes our program also exciting is that we are outcome-based. Being outcome-based means that when you come and see us, we are using specific measures. So you will fill out some forms saying how your symptoms have been in the last week, and we'll be able to track your progress throughout therapy. So as you get better, we'll be able to know. And if you're not getting better, our therapists are able to immediately know and adjust your therapy as needed. These outcome measures are things called, there's one for adults called the Brief Symptom Inventory. And when we eventually expand to children and adolescents, we'll be using the BASC-3. These names aren't exactly important to everybody in everyday life, but to psychologists and to the VA, these forms are highly valued and will lend evidence to the fact that you've been struggling. And it will also give a bigger picture once you have all of your therapy notes into what your mental health looks like. So it won't, if you come work with us for telehealth therapy, We will be able to provide you with all of those notes. You'll know what they say. You'll have an official treatment plan, and we'll track your progress throughout your time with us. If you decide, and you do not have to bring this information to the VA, this will help bolster your claim. It will provide more in-depth information than any kind of psychologist or mental health worker would be able to get in a 1-hour meeting for a C&P exam. The other nice thing is that we are telehealth. As COVID-19 has kind of changed our world, we as mental health professionals have also adapted. So we make ourselves very available through telehealth, and we're able to see veterans all over the United States. The other positive is that through telehealth, we can see you at times that maybe you wouldn't be able to see a therapist. So later at night, on the weekends, over your lunch hour, we'll be readily available to you. Another positive being that not everybody can get into therapy. Many of you suffer from physical disabilities that make it very difficult to get into a therapy office every week. And many of you also have mental health disabilities that make it difficult to even go to a therapist's office. So what we're hoping to achieve by being a telehealth therapy program is that we will be able to reach those in need who can't have access to therapy. We're also going to be expanding into more rural areas so that, clients who wouldn't be able to normally come all the way to a big city will be right there with you. It's convenient. It'll save you time in a commute, and hopefully you'll be able to use this information as more evidence. But in the long run, our goal at Valor Telehealth with this new program is that we will be able to help veterans have better mental health and to feel better and have higher life satisfaction. This is what our veterans deserve. They've served our country, and we believe that you deserve to be healthy and happy and thriving. I wanted to open it up to any questions that anyone might have about the Therapeutic Services Program. So if anybody has questions, please feel free to ask. Oh, how many sessions do I need or do you recommend? That's a really great question. So we are using the therapies that the VA uses that are approved, quote unquote. So an approved therapy is something the VA will have a psychologist, and that's what we'll be using as psychologists. They will follow a strict protocol of how to do the therapy. So for certain therapies, they recommend 8 weeks, and for other therapies, it can be longer. The longest therapy that we will be offering will be about 16 weeks. And our plan for our therapy program is that once you reach that 16 weeks, you would sit down with your therapist and they would say, do you want to continue, or would you like a discharge? And so when you do discharge, if you made that decision, you think you've made enough progress, we hand you a discharge packet. The discharge packet will have all of your progress notes. It will have your treatment plan. It will have all of your scores on those measures. And if you would like, and this would be an additional service, there would also be a nexus letter with that. So you would be able to take that to the VA if you wanted. Of course, if at the end of that treatment time, if you want to continue, then you're more than welcome to discuss it with your therapist. So the good news, because so many veterans can be a little bit wary of mental health, you don't have to stay with us for very long. Our shortest therapy is about 8 weeks. And like I said, our longest is 16. And so if you can commit to between 8 and 16 weeks, we would be able to greatly improve your mental health and also provide you with more insights into how to work better with the VA and get the things that you need. Any other questions? Will we take insurance? Unfortunately, right now, we are not taking insurance. We are launching this program right now, and it will be cash only. However, the thought process is that we will offer the best therapies that are recognized by the VA and that are also effective. We are concerned about things being recognized by the VA, but we also want those therapies to help you. So that being said, We are having people pay out of pocket for now. In the future, we may expand to taking insurance. But as we are just launching this program, it will be out of pocket only. We are trying to keep that cost to veterans as low as possible while offering the highest quality, best trained psychologists that we can find. If you're service connected for mental health, are fees covered by the VA? Good question. That is something that you would need to talk with them about. We are not affiliated with the VA. We're a private therapy. And so if you do take what we give you, we can provide you with something called a super bill. And a super bill is just something stating how much money that you paid for therapy, and you can take it to the VA and see if they'll cover that, or you can even send it into TRICARE and see if they'll cover that as well. Oh, can the person who did my evaluation also be my therapist? I love our evaluation team. I think we have amazing psychologists who are all very, very kind and understanding, have great experience with veterans. Unfortunately, if somebody has done your evaluation, they cannot be your therapist. This just has something to do with how psychologists work. That would be what we call a dual role. And so they wouldn't be able to be as objective or be able to give you the very best treatment if your evaluator also did your therapy. And it kind of goes both ways. So if your therapist did your evaluation, your therapist is going to like you a lot and they're going to care about you a lot. And so they're not going to be able to give the best objective understanding of you. And because of that, your therapist can't do your evaluation and your evaluator can't do your therapy. However, your evaluator will be consulted on who might be a good fit for therapy, and your therapist will also be consulted on who would be a good evaluator. The positive here is that we work together as a team, and so we can make sure that you are matched with the very best fit for therapists. Any other questions? Oh, how will this help your claim? So this will help your claim because many of you, especially who have served a long time ago, don't always have evidence of your mental health disability, or it wasn't provided, or the VA will sometimes say in a rejection letter, you never sought services. This is helpful because it is paper evidence and proof that you have been working very hard to get better, that you do have a diagnosis, and it will also provide additional, more in-depth information about how your disability has been affecting your mental health. The goal also being that it will help your claim by showing them that you are committed to getting better. And someone who is committed to getting better and having a better quality of life is probably more likely to be viewed by the VA as someone who is honestly and earnestly seeking a disability claim that they deserve. Other questions? When will we provide information on fees? Good question. So I own Valor Telehealth, and I am working currently with the owners of Telemedica to determine the administration fees versus the fees that the veterans pay. So I would imagine that within the next 1 to 2 weeks, we'll know that information. Just know that it should be similar to what you would typically pay out of pocket. And we are to a therapist if you're paying out of pocket, but we are not planning on having it be overly expensive, and the benefits of being able to meet with us anytime you want, and also that we know the VA and that we know how to write for the VA and use your notes to help you makes up for that cost in the long run. We don't accept Medicare currently. Right now, we are not going to be accepting any kind of insurance for our therapy practices. That is something that we will probably expand into, but because we currently see veterans all over the United States, what we as a company would have to do is make sure that each one of our psychologists it accepts that insurance. So it will take some time for us to get onto insurance panels, but it is definitely something that we are working hard to do. Can you help the rest of my family with therapy? That's also an excellent question. So we know that veterans struggle not just with their own issues, but that their families struggle. We know that when they come back from deployment, sometimes getting along with spouses after being away for a long time is very difficult. And then there's natural things that happen in families where, children might need help, teenagers need help, and families in general need to know how to come back together or need to learn better skills on communication and getting along. So our goal right now is to start with only individual therapy. And our next phase, once we are successfully doing that, is to move into offering couples and then adolescent, child, and regular family therapy. So our goal is to expand to be able to help your entire family. The other thing about doing couples therapy or doing child therapy, anything along those lines, what we're trying to show the VA, if you did take those progress notes, which you also would have access to with permission of the other person in therapy with you, is to show that this is impacting your whole household. Your mental health disorder is impacting everybody, and so therefore should be taken very seriously. The other hope being that your family and your partner all start doing a lot better and that you are, again, happy, healthy, and thriving. So what kinds of therapy are we using? So we are going to be using, that buzz term I just said, evidence-based practices. Those are things that the VA really, really loves, but also I love because they have so much research showing that they are helpful with certain disorders. One of the therapies we'll be using is something called ACT, which stands for Acceptance Commitment Therapy. ACT is something that helps you move past depression. It's been proven to help with anxiety and PTSD. We'll also be offering EMDR, which is eye movement desensitization. And with that, we'll be able to do EMDR via telehealth. And EMDR has been shown to be highly, highly helpful with PTSD. In fact, research in 2013 said that EMDR, after only 3 sessions of real EMDR, PTSD symptoms decreased by 70%. So the therapies that we are using are highly, highly helpful, and they also help you feel better. We'll also be doing something called CPT, cognitive processing therapy, DBT, and regular cognitive behavioral therapy. Those might be all words that you don't understand, but just know that all of these therapies are the very best, cutting edge, with the most research, and are the most likely to be helpful for you. We also will be having you meet with an intake coordinator who will match you with the kind of therapy that they think would be best and most helpful, so that you don't have to spend time trying one therapy out, trying another therapy out, and not feeling like you have a real direction. As a client of ours, you'll know exactly what your therapist is doing, what they're planning to do, and why they're doing it. Some veterans are hesitant with mental health. And so for us, the way that we will be working is that you will always know why we are doing something and what we are doing. We are highly transparent, and you never have to worry that we are saying anything or doing anything that would harm your claim or would harm you as an individual or your family. Can we help active service members? We would love to help active service members. Although we focus on veterans, our focus is really on the military personnel, on veterans in general, anybody who's been involved in the military, including military families during deployment. So we are highly open to helping active duty service members as well. Other questions? Well, we are very, very excited about this program. And we're hoping that we will be able to see as many veterans as possible and help change their lives. So stay tuned in the next coming months to find out when we will be launching and how to sign up. Thank you, everybody who came today. We hope you have a wonderful, wonderful day. Thank you.